Good morning all. Today we will be discussing on endotoxins and exotoxins. What are they? As you all know, endotoxin is a lipopolysaccharide which is a major component of the outer membrane of the gram-negative bacteria, which is released upon lysis, and this comprises of the core polysaccharide chain, the O-specific polysaccharide side chain, and a lipid component, that is the lipid A. The lipid A is responsible for the toxic effect of the endotoxins. Remember, endotoxins means it is the lipid A. So you can see the structure of endotoxins here. So you have the antigen, the core oligosaccharide, and the lipid A. And lipid A is responsible for the majority of the effect of the endotoxin. This is mainly released by lysis, and unlike the exotoxin, it is not secreted. And remember, all endotoxins are heat stable. And what does this do when it is released? It can increase the cytokines, it can increase the interleukin-1 and the TNF-alpha, and can produce non-specific effects like fever and shock. But do you know one thing? It has no tissue affinity, and only larger doses can be fatal, and it's poorly antigenic. So it doesn't mean that it is powerful. And remember, it's not neutralized by the antibodies, and it is not at all used for vaccine production. So if you remember these all key points regarding the endotoxins, you could easily differentiate it from the exotoxin. Now we will discuss with the mechanism of endotoxin. How does it act? Actually, the endotoxin, that is lipid A, will produce a macrophage activation, and lot of macrophages comes into play. It can stimulate the release of acute phase cytokines. Which are the acute phase cytokines? The interleukin-1, the tumor necrosis factor alpha, interleukin-6, nitric oxide, and the prostaglandins. All this can produce fever. So all these cytokines produces fever and inflammation and activation of the immune system, the T cells and B cells. So remember, first the endotoxin makes the macrophages activated, which produces the acute phase cytokines to go for a store, and again they call the immune system, that is the T cells and the B cells, for help. Again, lot of complements are activated. So you can remember by the way that macrophages gives lot of complements when they see the endotoxins. So complements get activated, lot of C3A and C5A gets released. Again, this causes promotion of the inflammatory cells, the chemotaxis occurs. Again, you have the high grade fever, hypotension, shock, which is produced by the vasodilation and the capillary leakage. And all this can produce endothelial activation, the coagulation pathways get activated, which all leads to increased permeability and the thrombosis and disseminated intravascular coagulation. Remember, the platelet is also activated and the mast cell is also activated. So again, platelet activation can lead to the release of mediators, again increasing the vascular permeability, thrombosis and DIC. Mast cell, when it is released, it can increase the histamine release, again causing the muscles to contract, increase the vascular permeability. And remember, in gram-negative septicemia, the endotoxins are released in large quantity, causing high fever, petechiae, and DIC, which may result in shock and possibly death. And what are the culprits? Which organisms can produce endotoxins? They are Salmonella typhi, Proteus species, Pseudomonas, Neisseria, etc. So when we have studied about endotoxins, just remember the points that we have studied in endotoxins. They are just the opposite in exotoxin. Endotoxins, they are lipopolysaccharides, but exotoxin, they are proteins. They are released by lysates, but exotoxins secreted by the gram-positive bacilli as well as the gram-negative bacilli. They diffuse into the surrounding media. Exotoxins are heat labile, has enzyme-like action and has specific action on the tissues, whereas endotoxins does not act is not tissue specific. Here it is more potent. Just a little amount of toxin can produce a devastating effects, and it is highly antigenic. Again, this is neutralized by antibody, and this is the basis for treatment for many of the bacterial diseases which produce exotoxins. Again, remember, this can be used as vaccine also because certain exotoxins has been inactivated to produce toxoids, which can be used for vaccine production. The classical example is the tetanus toxoid. So just a few words about toxoids. What are toxoids? Toxoids lack toxicity, but they retain the antigenicity. How is it prepared? It is prepared by detoxifying the bacterial toxins. The bacterial exotoxins are treated by formalin to destroy the toxicity and retain the antigenicity. Here, this is the picture showing the formation of the toxoid, which can be used for vaccine production. So this can be produced by inactivating the toxins by formalin, iodine, pepsin, ascorbic acid, ketones. The mixture is maintained at 37 degrees at a pH range of 69 for several weeks. And the classical example, as I have told you, is the diphtheria and the tetanus, the DPT vaccine. Few points regarding exotoxin. Remember, exotoxin has an alpha unit, A subunit and a B subunit. A subunit has the enzymatic activity, and B, as the name indicates, B stands for binding to the specific receptor and helps that exotoxin to go inside the cell and has its own action. So this is a representation of binding of the A component and B component. B component helps the A component to go inside. And now we know that there are a lot of exotoxins, and we will discuss the exotoxins one by one. First is the staphylococcal exotoxin, that is the enterotoxin, which can produce nausea, vomiting and diarrhea after 2 to 6 hours of consuming food. This is actually a superantigen which can again produce a toxic shock syndrome. So the staphylococcal enterotoxins and the TSST1 are superantigens which are the potent activators of T lymphocytes and which can produce a dysregulated immune response. So another bacteria which can produce exotoxin is Streptococcus. What is it? It is SPE, that is the streptococcal pyrogenic exotoxin. It has A, B, C and F versions. Again, this staphylococcal and the streptococcus are the superantigens. Remember, which is not a superantigen, it is the SPEB, whereas A, C and F is exotoxin. And this are superantigens, that is the staphylococcal and the streptococcal and exotoxins are superantigens, and they increase the release of cytokines, which is the key in the pathogenesis of the disease. Coming to another bacteria that can produce exotoxin, it is the Corynebacterium diphtheria. As you can see, Corynebacterium diphtheria, Pseudomonas and Shigella dysentery type 1, all these affects the protein metabolism, of which Corynebacterium diphtheria and Pseudomonas, these two inhibit the elongation factor 2 and decrease the protein synthesis. So here you can see the diphtheria toxin. The B binds to the cell, A goes inside, and A inactivates the elongation factor. So this is the elongation factor and this inhibits the protein synthesis, and this causes the cell to death. So coming to Shigella dysentery. So what is occurring here? Here the Shigella toxin gets inside. Again, as I told you, This Shigella dysentery is involving in the protein synthesis, but it is not the same mechanism as in Corynebacterium diphtheria, but here the mechanism is ribosomal inactivation. So it is different from the Corynebacterium diphtheria and the Pseudomonas-EXOTOXIN. Here the protein synthesis is inhibited, but it is by the ribosomal inactivation, as you can see here. So what happens to the Pseudomonas-EXOTOXIN? How do it act? Again the same thing as I have told you, same as that of Corynebacterium diphtheria. It is by the elongation factor inactivation, and hence there is defective protein synthesis. So to summarize, the bacterial toxins that inhibit the protein synthesis, it is the Pseudomonas, Corynebacterium diphtheria and Shigella dysentery type 1. Only Pseudomonas and Corynebacterium diphtheria has a similar action by inhibiting the elongation factor 2. But Shigella dysentery type 1, has a similar effect to the verocytotoxin of E. coli that we will discuss in the later slides. This inhibits the ribosomal ribosomes and inhibit the protein synthesis. And coming to the Clostridium family, there are a lot of bacteria in the Clostridium family that can produce exotoxins. One, it is the Clostridium perfringens, the Clostridium botulinum, the Clostridium TETANI. First we will discuss about the botulinum toxin. Remember, the release of the acetylcholine at the neuromuscular junction is mediated by the assembly of synaptic fusion complex. So only when there is synaptic fusion complex, this acetylcholine will be released into the junction. So for this to occur, you need to have a snare protein which include the synaptobrevin, the SNAP25 and syntaxin. So again, it is the synaptobrevin, it is the SNAP25 and it is the syntaxin. Only if these three are present, there can be a synaptic fusion complex, and after the membrane fusion, the acetylcholine is released into the synaptic cleft, and then it is bound by the receptors on the muscle cells. So what happens when you have the botulinum toxin there? The botulinum toxin, there are types of toxins like the B, A, B, D, C, F and G. So each toxin has its own affinity towards this synaptic complex. So the type B, D, F and G will cleave the synaptobrevin, whereas the A, C and E will cleave the SNAP25. Type C will cleave the syntaxin. In general, remember that this affects the synaptic fusion complex, that is the snare proteins. So botulinum toxin, the snare proteins are affected. Snare proteins affected, no release of the acetylcholine into the junction, and without the acetylcholine release, the muscle is unable to contract. So the muscle gets paralyzed. Very, very important point. So what is occurring in tetany? There are two toxins that is produced by the Clostridium tetani, the tetanolysin and tetanospasmin. Tetanospasmin actually it resembles the strychnine, but in the difference is that the tetanospasmin will act presynaptically, whereas strychnine postsynaptically. Just remember that toxin is presynaptic, strychnine, tetanospasmin is presynaptic, whereas strychnine is postsynaptic. So how does this act? This acts by the blocking the inhibitory transmitter release. Which are the inhibitory transmitters? That is the glycine and the GABA. This is not at all coming inside into the sport. So what happens there? There will be uninhibited excitatory transmitter release, which can produce a muscle spasm of both the agonist as well as the antagonist. So these are the toxins in the Clostridium perfringens: alpha toxin, beta toxin, endotoxin and the epsilon toxin. This produces a lecithinase effect, phospholipase effect, which can produce lysis of the RBC, increased vascular permeability. So remember, These are the three Clostridium that can produce similar effects, that is the very drastic effects, that is the Clostridium perfringens, Clostridium tetani, Clostridium botulinum. So Botox is the deadliest poison in the world. Remember, just 4 grams of the Botox is enough to kill the entire population of the earth. So that's why we call these exotoxins are highly potent, and only a minimum dose can kill the entire earth. Regarding the E. coli, remember the pathogenic E. coli can be divided into non-invasive and invasive. Non-invasive, the toxigenic variant, that is the endotoxinic E. coli, have both the heat labile and the heat stable variant toxins. The invasive, the non-toxigenic, that is the EPEC and the EIEC. Toxigenic, we have the enterohemorrhagic E. coli, and these 3 variants will be producing the 3 toxins, that is the heat labile toxin. Thus you can remember by this heat labile toxin, which is produced by the ETEC, can be remembered by the code, that is the LAMP, that is the heat labile toxin increases the cyclic AMP, which increases diarrhea in such sort of patients, whereas ST, that is the heat stable one, can increase the cyclic GMP, which can increase the diarrhea. So LAMP and stigma, that I remember by the codes LAMP and stigma. Whereas, as I told you earlier, the toxigenic variety, that is the enterohemorrhagic E. coli, can produce a Shiga-like toxin, that is a verotoxin, which can affect the ribosome and inhibit the protein synthesis. Just go through the previous slides. And the last one, but not the least, that is the E.COLI-toxin. The mode of action of the Vibrio cholerae is by the alpha A and B subunits. B subunits binding into the GM1 gangliosides, increasing the release of cyclic AMP. Sodium, water, chloride, and potassium bicarbonate all are lost through the diarrhea. Patient goes dehydrated. A very, very important toxin, that is the cholera toxin. Just remember the mode of action. To summarize, you can just go through the slide. You have studied now. Thank you for your patient listening. Hope you all understood all the points. Thank you all.